Moving forward into the implementation phase, we were new at doing this. We tried to implement utilizing our in-house staff as much as possible, minimize the use of consultants, not only for the purpose of minimizing cost, but also for the purpose of ensuring that as we were gaining knowledge about this new platform, that we were retaining that knowledge within the corporation.
We picked sites that we felt had a high probability of being successful, but yet gave us enough different flavors and problems that we would have to solve with that one to make the rest of the go-lives be successful.
The very first step we took was to start with 2 clinics, just 2, and we called them our pilot sites. And they came up live on October 1st with the Epicare system, which was the fully integrated module from scheduling, registration, provider documentation, revenue capture, coding, billing, and out the door.
Every time I talk to a provider, I think they're concerned about, how information technology is going to change their practice in the future. And what I'm trying to find out is how can I help them to do what they're doing, knowing that electronic records are our future, and it's probably the future for almost all hospitals moving forward.
I think my greatest fear was that it wouldn't work, that we would wake up one morning and not only would we not have the electronic, but we wouldn't. My nightmare was that we wouldn't have access to the paper product.
My expectation was that it would be chaotic, people would be very angry, people would lose track of things and be very upset. I was ready for my phone to be ringing off the hook.
You are going to be changing people's worlds, and that transformation is often, even if it's the right thing to do, is often wrought with resistance. Just because it's change. And the more you can get ahead of that and manage that, communicating and managing expectations, the more you can prepare people for that change, the more you can illustrate to people what the benefits of that change are, the more likely they are to accommodate that change and embrace it, basically, with their hearts and make it real.
When you implement the EMR, what you did in the past is what you did in the past. This is going to be all new.
All the clinics are spread out throughout the county, so at times they have different workflows. They also have a little bit of a different mix.
We're finding that the revenue cycle now moves from the back end of the process to the front end of the process.
We needed to develop specific training for the clinic managers. We call that role-based training. Their world immediately changed when they came up on Epic.
It was necessary for the clinic managers. They took on some new challenges to learn revenue and revenue capture and those type of things. So getting them used to work queues and kind of bringing them forward into the business world.
So things were a little bit different and not as standardized across the family health centers, and not having clearly defined processes up front of how we do every specific activity probably hurt us.
Sometimes, quite honestly, we didn't hit the mark. We ran into some problems early on. As hard as you plan, you're going to have problems. So a couple things had to happen. One was where they could standardize those processes. A team went in and undertook that. But then we actually had to still kind of customize what devices they use, how many devices they use, when they would use those devices.
What we did very well, I believe, is selection of super users from the staff. They provide the building of the templates, building of the smart sets that make things easier for the providers that use the system in terms of clinical documentation. Additionally, on go-lives, they are there to assist on-site at the elbow.
I think having a grasp of what our payer requirements were, what codes needed to be changed, what additional outside tools we have to make sure our codes and our billings are accurate and compliant. That I think we did exceptionally well.
We did many, many more things right than wrong. I think we involved the physicians appropriately. We involved the clinicians.
Well, our success surely has been with the adaptability of our people and the doctors, the willingness to make those changes that were necessary.
IT invested the right amount of resources. They had some strong program managers in the project.
As a project director, I first have to say that I'm very proud of the organization for the way that they accepted and adopted the product so far, because it's amazing how many people have said, my work has actually decreased because we put in an electronic system. Even though it was very scary before it went in, everyone has the trepidation of, wow, this is electronic, what am I going to do? I guess it's time for me to retire. However, once they understand the workflows and they actually get to use the system once in a while, then they begin to understand its value and how it can actually improve their life.
I think that was one of the things that we could say we did well, was to observe what happened, to improve it, modify it, and then have it ready to roll out to the next group. So we've been able to improve with each subsequent go live with those lessons we've learned from the prior groups.
When Epic came in here and they did their post-go-live assessment, their report was glowing. They said, we did a fantastic job, that this was one of the smoother implementations they've ever seen.
Things have gone smoothly. Everything has not been perfect, but the people in this organization and our physicians have tried very hard to make it work. They got involved, they learned the system, they didn't complain. If there were insurmountable problems on a particular application, they would report that in so that we could in turn work with Epic, iron out any kinds of problems that needed to be done with the system, and move forward.
Well, ARK in itself is a journey, and we've completed one step, but we really have a lot of work to do. The effort required to do that, I think, is going to make Phase 1 pale in comparison to what we have to do.
As each phase of this completes, we'll turn a page in the chapter. And, Betsy always says that, it's a new day at Maricopa. This small transformation of electronic medical record is a piece of that bigger transformation that we're trying to make here.
One of the important things about all of this is the timing is so perfect that we went on electronic medical records, because naturally the ambulatory care is going to be practiced in a patient-centered medical home pattern. And one of the absolute must for a medical home is to have the electronic medical record.
It was a tremendous jump for MIHS in terms of what I consider community respect. I think it demonstrates that we're not satisfied with the old image, the old status quo.
People here want to do the right thing. People here want to work together. This organization, more so than many organizations I've worked in, really is bound by kind of that sense of doing the right thing for our patients. I can say that the factor that was most critical to success in this project, and will be most critical to our future success in this project moving forward, is that we have the right people on the team, that we have a good team.